or for you to pose questions and us answer them at the end of the webinar. But if you find something that you need to throw in the chat in the meantime, we will go ahead and try to do that and answer those as we go. But please don't hesitate to put those in there, and we'll do our best to answer all of them at the end of the session. I'd like to introduce our director, Simran Singh. Simran has been with this office for 20-something years here, and just wanted to welcome her and let her take it from here. Thank you.
Hello, everybody, or should I say, welcome, Global Gauchos. Welcome to this beautiful University of California campus, which is going to be your home for the next few years, for between 2, 4, and 6 years, or maybe even longer. As they say, the fun, one of the fun facts right here is that both my daughters went to UCSB. They graduated from here. They did their 4-year graduation, and they're both successful professionals now. So this is a great institution where you're coming. You made a good choice. Excuse me. And I just wanted to make sure that we welcome you and make sure you guys are heard. But one of the things, if you ever went to the UCSB website, I'm sorry, and there is a saying there, which I really wanted to repeat. This is where land meets sea, where brilliant minds meet, and where academic excellence and social engagement unite to spark creativity and discovery, which is so true, because UCSB does, in our esteemed faculty, we do have 6 Nobel laureates, which is a great achievement to have within your faculty, and it gives you the opportunity to be able to work with them, and do some research with them. Next slide. I really apologize, I think is. So this is what we think we're going to be able to cover today, what the international demographics are, our advocacy efforts for you, tips for supporting students from abroad, and this is more for parents and siblings and relatives who may be on this call. Campus resources for international students, academic integrity, in-person instruction, housing, which I know all of you had a lot of questions, and we hope to give you some updates on that. And we will have the former director of student health services at UCSB, Dr. Mary Ferris, joining us for the student health services COVID update section. And of course, like we said, we will be answering some questions for you. Throw them in the chat. We'll be happy to answer them. So at UCSB right now, what we're looking at is a total population of over 26,000 students, and over 5,000 students, a little less than 5,000 students on as internationals, we're international here. We have the breakdown right about here about how many undergraduates and graduates. This definitely tends to be the case where we have more undergraduate students than graduates. And of course, scholars. We have 521 scholars on campus right now. So our international students, both graduate and undergraduate, are about 17% or a little over 17% of the total student body here. And as for scholars, our scholars are here to work with the esteemed faculty. They are attracted because UCSB is a leading public research institution, and scholars kind of seek out our faculty to come and do research with them, and come out and publish their research. Our top nationalities, not a surprise, we are China, India top the list. And we have our brilliant students and scholars also. Those two probably would be the top of the list. Next slide. We just wanted to start with saying, we really hear you. We've been hearing your questions. We've been hearing your frustration. We listen to everything you say to us. But what we do with all the messages that you send us is that we actually then push those messages to the appropriate departments or committees so that you are heard right to the top. And the different committees that are working to make sure that you are welcome on campus and you're getting all the information that you need and all the assistance that you need can actually work towards that and are there to give you as much information as possible. For us, it's advocating for you to make sure that you are heard, and absolutely we value you. You know, it's just like you bring so much diversity, you know, to our campus. You bring your culture, your food, your international perspective, and all of this is important because it educates us and it educates the domestic population. So, you know, we definitely value you on this. And we have a campus COVID task force, which is really working hard to make sure that your return to campus is absolutely safe. Now, what is in the OISS purview? So our office is charged with anything that's immigration related. We help you, you know, we really help you kind of manage that complex and you know, it's just a complex immigration process. So we want to make sure that we're here to help you. We issue your DS 2019s or your I-20s. We answer any questions you may have regarding that, as well as once you're on campus, we help to register you, make sure that you stay, you know, you stay registered, and we work with you on employment while you're a student and after you graduate. We help you file, you know, file the paperwork with immigration to get permission to work after you graduate from here. So that's what's in our purview, but what we do is absolutely make sure that whatever you have, any issues that you have, is absolutely shared with the leadership of UCSB to make sure that the issues that you have are addressed. So this is something that is really dear to my heart. And that is, if we have any parents, siblings, relatives who are on here, it's important for you to be there for your students or for your brothers or sisters who are here to support them from afar. This, as they're coming into the system, into a quarter system, it is really difficult. It is a fast-paced system. You only have 9 weeks to a quarter. And you have to, at this point, really, if you're not used to this quick pace system, it is a struggle in the first quarter to really adjust to this new learning system, as well as try and understand how quickly this whole thing, the quarter passes. So it is stressful, but you need this, you know, if you are a parent or say, you really need to encourage your student to just support them during this stressful time. One of the things I want to make sure that everybody understands is the Family Education Rights and Privacy Act. Well, this is very, very firm here in the US, and we call it FERPA for short, just to make sure that unless your students give you permission to view anything, we will not be necessarily sharing any information about the academics to you. That is something that is the right of the student to know. So if you call us and you want to know how the student is doing, you want to know grades, you want to know any, we're not going to be able to help you. Unfortunately, the student has to be the one who will need to do this for you. We also encourage you to support your students' holistic growth. And what do we mean by that? You know, don't stress the students out. Understand that they're already under a lot of stress because, one, they're in a new culture. They're in a new place. It's a new educational system. All of this takes a toll on their mental health. You know, so we want to make sure that they're supported, that they have your support to help them, to encourage them to carry on and go forward. You know, their social, spiritual, physical, and other, you know, intellectual health matters. So your support is absolutely primary. I lived here and my daughters went to school here, but I had to still be a supportive parent. I had to understand the stress they were under. I had to understand. And yet they were they were not international students. So if a domestic student feels the stresses of a quarter system, your students will too. So please listen to your student and believe in your student. If they tell you that they're having a really hard time with the major that you have asked them to do, my suggestion to you would be that once the students are here, they can figure out that they're really not cut out maybe for that major. There are a lot of other majors that the student can take, change their majors and be really successful. Now, this is a conversation that you have to have with your student, but support them while they make this decision. And the more you support your students, the more successful they will be, and they will shine. I can promise you that. Next slide. Now, for the students, there's a lot of help available to you right here. And these are, just a few offices that we're listing here that you will need and can need. First and foremost would be the Campus Learning Assistance Service, which we call CLAS. This is class. There really is free tutoring for you. You can actually sign up for these and go to classes where the students or the teachers who are with CLAS actually attend lectures, are able to help you understand the subject matter. They can help you with your homework. They can check your homework through. CLAS also has a writing lab where they can help you with your writing assignments. They don't write them for you, but they will have you submit something that you've written, and they will go ahead and give you suggestions how you could make it better. Then we have counseling and psychological services, also known as CAPS. This is really a great resource that we have for our students. Now, going to CAPS or going to counseling or psychological services doesn't mean that there's something wrong with you. It's just a place for you to vent if you're frustrated, if you are homesick, if you are having issues. And you can figure all these out because you suddenly realize you don't want to study, you don't want to hang out with your friends, because there is something that's bothering you. And honestly, it's normal, this is going to happen. So you need to be aware of that and know that there is something available for you. There are counselors who will talk to you and, just talk you through this, whatever you're feeling, and kind of let you know that this is normal. But also, in case you need any help, they're there for you. So we really encourage students to help, if they need help, to seek out counseling and psychological services. Housing, of course, it just goes with housing, but all of their services provided to you there. There's meals, there's programming that they do, of course, and any other services that you would require is with housing. UC student health insurance plan. So you all will come with we call it the UC SHIP, which is the student health insurance plan. It pretty much takes care of all of your expenses here. You do have co-pays, but they're very minimal. But most of your things can be taken care of here. We have the student health situated right on campus. So anything minor or any kind of injuries or things that you might have would be taken care of right here. We do have, I think they also have a dental clinic as well as an eye clinic. So everything pretty much in whole is provided for you on campus, unless it's something serious where we have a hospital right close by. So you're taken care of, and your UC health insurance pretty much takes care of all of that. With the recreation center, again, something that I always encourage students to go out and do stuff. You're here, we understand you're going to be studying. There's a lot of stuff that you're going to be doing. You're going to be busy, but it's important for you to have some physical activity, some way of kind of relaxing. And the rec center's a great place. I mean, we have 2 huge pools. We've got a climbing wall. We have the state-of-the-art machines up there. So great place for you to go hang out, just relax a little bit. And least and not the last is the Associated Students Food Bank, also known as the AS Food Bank. which really has supplies for students, just in case you run out of something or you're having any difficulty, you've not been able to get the, your parents haven't been able to send money across, and you really are looking for stuff, and the Associated Food Bank is situated right here on campus where you can go and pick up stuff, and they have everything there. All of this is provided to you. So these are just some of the resources that you have. There are plenty more, but I just wanted to touch upon these because these are really most important, and these are the ones that we see students using the most. Next slide. This is another topic that I don't like covering, but I think it becomes very important because all of you come from a very different educational system where things are, the expectations are different from what the expectations are here at UC Santa Barbara. What we really want you to be aware of that, what does academic integrity mean? It just means that you submit, what you submit must be your original work. So it is just as easy for anybody to have to write, say, an essay, to go on online and look up something and go ahead and reproduce work from there, or even just take bits and pieces from there. Now, that is not your work. Unless you cite the person who you took this from, this does not reflect your own personal work. So that is something that we take very, very seriously here. It is one of the things that will literally lead to a major disruption in your plan, your graduation plan. So UCSB has policies. You need to be aware of these policies. You need to ask your professors, what are their expectations? Most classes, your professor will tell you what they expect of you. In some of the places, they have collective work, but collective work doesn't mean that it's one paper with 7 names on it. Collective work means that everybody gets together and works on, on a project. But at the end of the day, you're going to write your own paper from what your understanding is of that collective work. You have a lot of resources that we have available on our OISS website. So, and also remember these, when you turn in a paper and the professors had some contact with you, they can pick a few words from your work that you've submitted and punch it into a program on the computer, and they can come out and know that you copied from somewhere. So those are things that you want to be very careful on. And I understand that because I come from India, where the highest honor you can give to your professor is to actually work, whatever they say, to learn it and reproduce it as an answer is something that would get me an A+. And I realize here in the US, that's not the case. What's going to get you an A+ is your own work in your own words, your understanding of the subject. So please be careful. And as international students, you could have serious consequences if this is a violation and it is reported to our Office of Student Conduct. So very, very important for you to keep this in mind when you go to school. Be aware of what the professor tells you. Every class has their guidelines before they begin their classes. Next slide. So as you saw from the Chancellor's email that went out on August 27th, that we're all returning to in-person learning on campus. We are an in-person institution. We were able to quickly go remote because it was required at that time because of COVID. At this point, things are under control. All of us have been vaccinated and campus will open as of September 1, which is today. A lot of us are back on campus. We've been working really, trying to get everything ready so that we can get back and be here to welcome all of you to campus when you get back, starting 20th of September. But make sure that you maintain your status, which means that you stay enrolled in your units as required, 12 units for undergraduates, 8 for graduates. And we are at this point monitoring the situation on the ground. If anything does happen or things change, we will quickly go back to a remote process. But we have to wait and see. As of now, it seems like we're going absolutely in person. All classes are going to be in person. Next slide. So student housing. So we understand everybody's had a challenge. It's been a challenge for us because we're not bringing in one class. We're bringing in 2 classes this fall. So the one classes, they started remote last year in fall 2020, but this is going to be the first time that they're coming onto campus. And so for us, we all of a sudden have this higher requirement for campus housing. And also, we're trying to keep our housing rooms to 2 people, so we don't have to triple, making sure that we can provide as much housing as we can, because we also have to make sure that we have space available in case we have to quarantine anybody. So this is an ongoing effort that's going on. Now, we have housing on campus, and then we have Isla Vista, which is a neighboring community right next to campus, and that has additional housing that is private. And a lot of students prefer to just be living in these apartments with their friends. Unfortunately for us, even there right now, people are preferring, instead of having 4 people share an apartment, they just want to have 2 people share an apartment. So there really is just a demand for lower density everywhere because of COVID, and students are concerned, and that really is an issue. So there's just ongoing efforts by the university. We know that a lot of the students have been offered contracts, but now we are in the process of even trying to negotiate with hotels where students could stay at the rate at which they were going to be paying at the university. So there's a lot of stuff that's going on. There is a committee that the chancellor has set up that is looking into all the problems that we're having with housing. And hopefully by the time September 20th rolls around, I think everybody that needs housing will be housed. So that is what I wanted to share with all of you, to make sure that you understand that we are not taking this lightly. We understand all of you have had a lot of issues, but we're going to work with you to make sure that you get the information that you need and that you will find a contract. But you need to work with the housing department and make sure that you're responding to all of their emails and all the messages that are being sent out to you. So with that said, that was what I wanted to go over with you, but I'd like to have, I'm going to have introduce Dr. Mary Ferris and Mark McGilvery, who are from our student health services, and they would go over some of this, the COVID updates that I know all of you are eager to go over. So Mary, Mark, welcome.
Hello, thank you. We're happy to join. I'm a medical physician, and I'm the campus COVID-19 clinical advisor. And Mark McGilvery here is our IT director for student health and the CAPS Counseling Center. So we hope we can answer some of your questions about what the campus is doing to keep everyone as safe as possible. We call that mitigation strategies. And then we'll tell you a little bit about online resources, how to use the student health patient portal to fill some of your compliance requirements for the COVID mitigation requirements, and then some of the details of what's needed on campus, what we're planning for you all, and we hope to be able to answer some of your questions. So next slide. We have spent a lot of time working on our websites to try to give you all information. And as you know, this has been changing daily because the situation changes. But I want to direct you especially to the student health website. And the 2 things I've circled there are that we have a special section just for coronavirus. And then we have something called the patient portal. And that's going to be a really important place for you all to go, so that you can make appointments at student health, both for vaccines and for COVID testing. And that also you can upload any documents for vaccination compliance that you might need. And we'll go through a few more details of that. So next slide. This is what happens when you click the patient portal. We just want to tell you that you click the patient portal to get in, then you see the choice of either students, faculty, or staff, or authorized representatives. So you're going to pick the student choice, and then you'll enter your UCSB net ID and password. Next slide. And then you'll be presented with this screen. This is the way it looks for me. And you'll see right on that front page, your splash page, your landing page, that at the top it says show in a blue bar, show badge clearance. And that's where you will be able to get your clearance badge after you complete all our requirements. So if anybody asks you, such as when you're in housing and you need to go into the dining hall and they want you to show your clearance badge for COVID, this is the way you would be able to display it. You just quickly go into this website, log in real quick, and the badge will show up for you. Then also you see in the second bar says complete a survey. And that's where you'll go every day to complete just a 5-question COVID-19 daily screening survey. Everyone on campus is going to have to do this, faculty, students, staff, in order to use our campus facilities. And it screens you for any symptoms of COVID, or whether you've recently had a COVID diagnosis, or whether you've been in close contact with someone, and then it gives you instructions what to do. So that's a major way that we're trying to keep our campus safe, by having everyone complete this daily screening survey. And that's part of getting your clearance badge for the day to complete that survey. And then finally, the third bar is schedule an appointment. So that's really important for you too, because some of you were unable to get your COVID vaccines in your own home countries and will need to get one of our US approved COVID vaccines as soon as you arrive here. So you can even go today to schedule your appointment to get your COVID vaccine. And you can also go today to schedule an appointment for a COVID test when you arrive, because that's another one of our requirements for everyone moving into campus housing, that they have a COVID test right before they get the keys to their room. And just before we leave this slide, you'll notice along the left, it's pretty small, but there are several choices available there. Medical clearances is where you will see if you have complied with the requirements. Appointments, consent forms, messages. This is a way to securely message student health about personal health problems. Then surveys is also a place where you might be directed to complete a survey. And finally, you can view some of your medical records or make requests for records. So it's all online at the Student Health website, and we hope that will help you all to efficiently comply with a lot of our requirements. So Mark, please interrupt me, Mark, if I'm saying anything wrong. All right, good. Next slide. So let's talk a little bit about how to be cleared on campus. I think I just showed you the patient portal, and before I leave that, I want to be sure that all of you have uploaded your vaccine information. If you didn't get a COVID vaccine at UCSB Student Health, we need to know where you got it. And there, if you go into the medical clearances section, you can upload your documents there. So some of you got COVID vaccines elsewhere, and we need to have that document uploaded before September 9th, that's next Thursday, to be sure you're complying with the requirement that all UCSB students have a COVID vaccine. And that's also where you will go if you want to ask for an exemption because you have some medical reason why you can't get a vaccine, or a religious belief firmly held that would prevent you from getting a vaccine. And also, probably most importantly for international students, you can request a temporary deferral because you couldn't get the vaccine in your own country, or you could only get one dose. So you didn't have you're not complete in your vaccine series. So you do have to request a temporary deferral, and we want you to do that there on that student health portal by no later than next Thursday. Although I'd also recommend that you do it by this weekend, because on Tuesday, we're going to start having to block students from seeing their class schedule or changing classes if they haven't complied with this vaccine. So it's one way that we're really serious about trying to keep our campus safe by maximizing as much as we can the number of people on campus that get COVID vaccines. We're already almost up to 90% of all of our campus has complied with this. So it's only a few of you out there that haven't done this. And if you have any questions about it at the end, we will have a email address where you can put in your questions, make sure that you've done it right. So then we want to talk about the COVID-19 badges that you get after you complete this daily survey. You'll either get a badge that says green, you're cleared to be on campus and use campus facilities. And when you go to the recreation center, they'll ask to see that badge. And when you go to the dining hall, if you're living in university housing, they'll ask to see that badge too. So the screening survey, only 5 quick questions, will turn your badge green if that's the only requirement that you have. But if you are an unvaccinated student, even temporarily, because you're waiting to get your vaccine when you come to the United States, your badge will be purple unless you get the required testing, because it's really important if you're not vaccinated that you get the COVID test when you arrive in campus housing. And then we also ask that all those students arriving in campus housing get a COVID test 5 days later. That makes sure that you don't have any COVID that's brewing from when you traveled. And then after that, all students who are not completely vaccinated have to get a COVID test on campus every week. And that's free on campus. It's offered at no charge to you. It's a quick 5-minute experience. You make an appointment for it through that same website I just showed you. And it's going to be located either in the main center of campus in a place called Loma Paloma, or in the Santa Catalina area on the edge of campus in a place called Linda Vista. But I know you'll all figure that out. You're so smart once you get here, and you'll figure out on the map where that is. But I just want to let you know you can do that today. If you know your move-in date, we want you to go to the Student Health website and make an appointment for before your move-in, just at 5 minutes, 10 minutes, a half hour before, so that you get your appointment before you go to ask for your keys. You want to get your test before you get your keys, and that's the way we're going to be sure everybody gets the tests that they need. So the bottom line is everyone who's coming to campus housing needs to get a test before they get their keys. You can make your appointments now, and that your badge, your clearance badge will turn green once you complete your daily survey and you get your required test. Once you're in the testing center, the badge turns green within minutes. If you do get a purple badge that says not cleared, it'll say on the badge in a banner why it wasn't cleared. It might say daily survey needed or lab test needed. So that'll help you, we hope, figure out how to correct that so that you can get your clearance. Next slide. So here's some of the things I was just talking about: housing arrival. Not all of you are living in campus housing, but I think a lot of you probably are. We're going to have you complete that daily screening survey, which is through the Student Health website. And I think most of you might have noticed just today, you started getting email reminders to do that. We will be sending you every day an email and a text reminder if we have your cell phone to complete this daily screening survey. So if you're not on campus right now, you don't need to do that. But when you arrive on campus, you will need to do that if you're living in university housing every day. And for other students, any day you're coming to campus. So you might as well just do it every day. So then we also talked about how to get the COVID tests and make your appointments. Then talked about how just for housing students who are arriving, they need this extra test 5 days after they arrive. And that is even if you're vaccinated or not vaccinated. In the United States, our public health officials are in an agency called CDC. You've probably heard of that, Centers for Disease Control. They recommend that anyone who's arriving after international travel have a COVID test 3 to 5 days after they arrive in the United States. So that we'll be catching you all when we do this follow-up test in 5 days. And then after that, the only people that have to get COVID tests are those that aren't completely vaccinated yet. So that means if you have no vaccine or you have incomplete vaccine series, we want you to have a weekly COVID test, make it an appointment the same way through the Student Health website. But I also want to let you know that other students are welcome to use that free testing. All the students on campus can schedule a COVID test appointment up to once a week. So if you are worried that you might have COVID or you think you've been close to a person who might have COVID, don't hesitate. We want to provide those tests free for everyone and try to catch cases really early to keep you all safe so that we can identify cases, prevent them from spreading on campus. Next slide. So I think I've gone over this, but once more to summarize, if you're unvaccinated, you will need the weekly testing. And then I'll add one more thing is that the University of California, for all their campuses, suggests that when students are arriving in housing who are not vaccinated, that we should ask them to do something called sequester for the first 7 days. And sequester means avoiding large social gatherings. Just because when you're first coming, if you're unvaccinated, we don't know if you've been exposed during traveling, you might be developing a case of COVID-19. So we ask you to stay pretty cool in your rooms the first 7 days. You're not in prison in your rooms. You can leave for getting food, doctor's appointment, for going to class, but to avoid big social gatherings, just those first 7 days so that we minimize the chance that you might be developing COVID and could spread it to other people. At the moment, we're only asking students in housing who are unvaccinated to do that. And here's the information for more, here's the contact numbers for more information. We have a call center at UCSB that tries to help any kind of COVID related question get sent to the right place. And that's through the email address listed there on the screen, or you can even call and talk to a live person on weekdays between 8 a.m. and 4 p.m. And that number is actually answered by your fellow students. We employ students to help each other find out the answers to all these complicated COVID questions and to get to the right place. So I think sometimes on campus, you may find it's hard to talk to a live person, but this is a phone number where actually I believe you will be able to talk to a live person, and it'll be a fellow student who will help you. I also know there is plans to have small students on campus dedicated to just answer questions in this difficult time when there's lots of changes. They're going to be at little booths around campus, and it's going to say, "Ask me" on the booth. So don't hesitate to stop in there and ask them your questions. We want to help you, and we all understand how hard it's been with all the changes and the stresses of trying to keep safe during COVID. So that's the COVID, the end of the COVID presentation, and we will be happy to answer questions.
Perfect. Thank you so much, Mary. And Mark, thank you too for jumping right in on the chat there. So thankful to have both of you here right now. This has been great. And thank you to everyone who's been posting some great questions here. I see several of them have been answered, but just wanted to just remind folks to please refrain from putting any kind of personal information on the chat. And if you have a really specific question about your individual circumstances, you can always feel free to contact us at our office, and we can then correspond directly with you regarding your individual circumstance. But if you don't mind, I just wanted to take some of the questions on the chat, and maybe Mary, you could help answer some of these, and we'll try to cover as much as we can on these. If for some reason we're unable to answer them at this time, we will certainly ask you to email us directly, and we can do some research and follow up with you if we are not able to answer them right now. One of the first questions is about the UC health insurance. If I want to visit a psychiatrist and need prescription medicines, will the insurance cover this cost for me? I've contacted someone in the insurance today. They said I have to pay copay for the meds. So do I have to pay full cost or partial? I'm assuming that means for the service, maybe not, and for the prescription.
That's a great question, because I think all of us will be sympathetic to you. The shock that international students feel when they come to the United States and discover how difficult it is to pay for health care. We don't have free national health care, and there is a lot of complexity to it. But at the if you have the UC SHIP, that's a student health insurance program, if you have purchased that UC SHIP health insurance, it covers all your care at student health, in the student health building. So that's the most economical way for you to seek care, is to go to student health for your visits, for your medical care. Now, in terms of the pharmaceuticals, the prescription drugs, again, getting it at the student health pharmacy will be the best value for it. There are what we call co-pays for the prescriptions, and the way they structure the insurance, it's in different levels, but most drugs are just $5 copay. You won't be paying hundreds of dollars. You might have to, if you have a very expensive or specialty drug, you might have to pay $50. I don't know the exact cost, but there are different levels that you should be able to know in advance. And don't ever hesitate to ask at the pharmacy. how much it's going to cost before they send you the bill. You know, that's a very smart thing to do. And in fact, when you are seeking healthcare anywhere in the United States, it's always wise to ask, how much is it going to cost before you find yourself in a difficult situation. I'll just say one more thing, that UC SHIP health insurance covers you at other places, anywhere in the United States. But there is something called a network that you will get the best value, the lowest costs, by staying within the network of that insurance, which is the Anthem network. So I would encourage you to ask questions at the Student Health Insurance Office, just because we understand this is very new for you. But in general, I would encourage you to use Student Health for your health care, and they will help guide you to the most economical services.
Perfect. Thank you. I just want to remind everyone to please put your questions in the Q&A function rather than the chat. That way, just kind of be sure to focus on one spot here. Looks like we just have a couple comments here. Thank you for the information being provided. We're more than happy to do that for you all. We really appreciate you showing up for the webinar today. So thank you for joining us here. Also, it sounds like a little shout out here to the housing team. And I'm glad that you have had some success there. So thank you for acknowledging that. And again, we're happy that you're here to join us for this and to learn more about these things. Next question here, that they have received their dorm arrangement and everything is well organized. However, their building, this is maybe less medical, but their building isn't open for the holidays. I'm wondering, this only means that the building isn't open when the quarter ends, or does it close at some holidays like Thanksgiving and so on? I am not sure that there's anyone on this call specifically that can speak to the detail of that. This might be a question we need to follow up with our housing department on.
Actually, I can take that.
Sure.
It's basically, yes, most of the dorms are closed for the holidays, but it doesn't mean that you have to move out. You know, most of the students do go off to see their friends, or they go back home for major holidays, but you're allowed to leave your stuff in the dorm room and, you know, and leave. But on the other hand, if you really know that you want to have accommodation through the holidays, you would have identified that when you got your contract to say you needed holiday accommodation, and then that would have been arranged. So I'm not too sure if that is still going to be possible now, but you could reach out to the housing department to see if that's even a possibility.
Okay, thank you, Simran. Next question here is about arriving in Los Angeles on September 10th, but I can't arrive to Santa Barbara until the 19th. How can I meet the required CDC, to meet the requirements of the CDC and get COVID test within 5 days after arriving in the US? Should I find the test agency by myself?
Well, thank you for trying to be so compliant. Yes, I think that would be advisable. If you're in Los Angeles, there's free COVID testing through the Los Angeles County Public Health Department. I can look that website up for you, but I'd say Google free COVID test Los Angeles County, because we don't want you to have to go to a pharmacy and pay lots of money for a COVID test when it is offered free by the public health departments of each county. So that would be very wise of you to do that. Thank you.
Thank you. What tests are required for vaccinated students?
If you are living in campus housing, we are requiring that even vaccinated students obtain a test on our campus the day they arrive to get their keys. So that's, and then 5 days later. I think that the reason I'm hesitating is we're not sure if we're going to enforce that for vaccinated students 5 days later, but at least on arrival, before you get your keys, you need a campus test, both vaccinated and unvaccinated.
Thank you. I think this may have been answered in the chat here, but the question is, and maybe for the others who didn't see that there, it just says, where can I, is there anywhere I can look at what is covered by health insurance? For instance, are dental treatments covered? Which pharmacies are student health pharmacies? Could you please point me in for relevant documentation?
Yeah, and that's where I think your best place to start is the student health website. They have a section on insurance. And yes, dental care is covered, so that's a nice advantage of this program. And those are all those details that are complicated in the United States. So I think you definitely should look there. Look under specifically UC SHIP academic year 21-22, and you will see they'll give you details of what's covered or not covered.
Thank you. This is a good question. I'm sure many of you have thought this as well. What if my roommate tests positive for COVID-19?
Yes, we will, if you're living in the dormitory housing, university-owned housing, we will be removing the roommate. They have to go to an isolation room. And the campus has set aside some really nice rooms. They're comfortable to take people who have positive COVID tests away from their roommates so that they don't spread it to their roommates. Then we'll tell the roommates to get tested. We'll ask them if they have symptoms or not, but most of the time you feel fine, but we'll suggest you go get a COVID test. And if it's negative and you're vaccinated especially, then nothing to worry about. We feel like it's okay. But the campus has reserved rooms just for this purpose so that we can try to prevent it from spreading among different students.
Thank you. There's a note here, they've completed their second dose. That's good news. It's always great to have that done ahead of time before arriving to campus. So thank you for noting that. This question goes to the academic side of things. Simran touched on this a little bit, but will larger courses be online?
No, at this point, all courses will be in person unless there is a need for us to be able to, or that we need to move all our courses remote. At this point, no such information available. It will be in person.
Next question says, I arrive on the 16th. Is it possible to move in a day earlier, or should I look for another place to stay? Are you moving on to campus? I'm assuming that question is regarding campus housing. That would be is that you should find accommodations for the single night stay until you're able to move into your residence based on the date that was assigned for you. One of the tips, I had actually a student ask me this today, I would recommend looking in the Goleta area for a hotel that's really close to campus and very convenient. So if you're having to move your luggage around and things, it won't be schlepping too far. So yes, you'll have to find accommodations for your first night and then transition into campus housing. Thanks so much. I need to apply for staying in dorms for the holidays or when the quarter ends. Simran touched on this a little bit earlier too, but I would say reach out to housing and just to make sure that you're within their guidelines for that, but it should be part of your original contract that you signed with them. So take a look at that and follow up with them if you have any specific questions regarding dates of when you can be in your room. Hi, I tried to schedule a COVID test appointment at UCSB Student Health, but it showed that the scheduling not allowed.
Yeah. This is what we want Mark to answer. Great, Mark. What can you tell us?
It depends on so many things. It depends. There's a couple of things you need to do before you try to schedule an appointment, but it should tell you that you need to do some compliances like the notice of privacy practices. So the other thing is, if you're a new student, again, you should be able to schedule your tests if you're returning. These are all new students, right?
Yeah, generally.
Okay, so
yes.
if you're new students, you should have access for that. Do me a favor, when you log into the portal, there'll be a little message link for an email address where you can send a request. Send in, if you're sending questions about logging into the portal or scheduling an appointment and you can't, sending an email and you can't, send a message to the email address that's on the login page. Give them your name and your perm, and we will find out what the issue is, and we'll get right back to you.
In the Ashley, in the chat, there's another IT related question that Mark might be able to answer too. My badge shows lab test is overdue, but I have submitted the COVID immunization. How can they make their clearance badge turn green?
Right. So if there is a deferral, it should, if you've requested a deferral, Okay, and if I'm reading this right, there's a deferral request. You should already have an exemption pending, whether it's been approved or not, doesn't matter, and that you shouldn't have a lab test requirement. So if you are immunization compliant, meaning you've submitted on the portal, and make sure that you go into the portal and upload your card and be sure to enter your dates and the vaccines you've received, or request an exemption. So the exemption, as Dr. Ferris mentioned, can be for medical reasons, religious reasons, or you want a temporary deferral because you're in the middle of the process of getting your COVID shots. So if you have a deferral in, you should already not be required to have a lab test. So there's so many things going on here. Again, and I've said this too many times, send a message into either the email address that you have on the login site, or I put it in the chat, the SHS immunizations email, and they will make sure that they can get you straightened out.
Yeah, we know that we'll have to work through some individual situations.
Always.
But I do want to encourage any student that needs a COVID vaccine from Student Health to go ahead and make an appointment for that when you know you'll be on campus, because those appointments are open for students right now. And we will give you plenty of time to get your 2 vaccines and be fully vaccinated before we stop you from being cleared to come on campus.
This is a question that says a little off topic, but that's quite all right. We welcome that. Is it complicated for an international student to get a job on campus?
Eric, you want to take that one?
Sure. It is not complicated to get a job on campus. You'll want to go through Handshake, which is through the Career Services Office. And that's where all the campus departments will post their available jobs, and you can apply online through Handshake. And if you need to get a social security number once you're offered that job, that's when you'll go through our office through UCSB Global. There's an e-form that you'll fill out if you receive a job offer on campus, and we'll be able to provide a letter to you that you'll take with you to the Social Security Administration to be able to apply for your Social Security number, and you'll provide that to your employer on campus. So the hardest part is, interviewing and finding that job on campus. But once you've been offered that job, it's very easy from there to start your employment. So we have a webpage on our website that goes over on-campus employment. So feel free to review that, and then use the Career Services Office if you need help with a resume or a cover letter or interviewing. If it's your first time applying for a job ever, you might want their help with any sort of job search strategies or how to make yourself look like a good applicant for an on-campus job. So definitely you can start working your first quarter here on campus if you want, but just keep in mind that you might want to adjust to UCSB before you get a job, but it's very easy. So please definitely take advantage of that.
This next one would be for you, Dr. Ferris. Again, do you need to make an appointment for a COVID test before moving in on move-in day?
Yes, we do want, yes, we are doing these COVID tests by appointment to avoid everybody just crowding and being there all at the same time. There's plenty of appointments. I just checked this morning, every 5 minutes we do a test. It's real quick. So we advise, once you know your move-in day and about the time that you think you're going to be moving in, try to make your COVID appointment a half hour, an hour before that, so that your COVID test appointment, so that you get your test, and then your badge will turn green and you'll be able to go get your key at the right time.
Can I still get an additional dose of the US approved COVID-19 vaccine if I have been fully vaccinated in my home country?
That's an interesting question. That would be considered a booster dose if you got an approved vaccine, either WHO approved or FDA approved from the US. And we aren't giving booster doses quite yet here in the United States. But we think by the time you all arrive for classes, maybe by the end of September, those will be available at Student Health. So I would say hold on and we'll see what happens. I think the other situation we know will happen is, what if an international student comes to the United States with a non-approved vaccine? Because not all of the international vaccines have been approved by WHO or the United States FDA. And in that case, yes, we will counsel you, tell you the risks and benefits, but we would be happy to give you a US vaccine if you received a non-approved vaccine in another country. It's a very ever-changing situation, but luckily we have a really good student health center on the campus, and they are able to provide these COVID vaccines at no charge to you. And there's a good supply in the United States. We haven't had supply problems recently, so you can feel confident you will be able to get what you need.
This is an academic question in nature, but I want to make sure all language classes are online. As much as we would like to be able to help that, that's not going to happen for fall quarter. Again, we're working on local protocols, and we are within those boundaries and should be offering classes in person. So unfortunately, that won't be the case for this fall. Probably not, hopefully not likely in the future, just because we hopefully will be in a good state in terms of our COVID numbers, and we'll be able to remain all in person. So thank you for that question. The next one is, can I get a social security number out of Santa Barbara, but within the United States? Yes, the answer to that is yes. The social security number that you will be given is actually a federally issued one, and it is used across the United States. So if you do get it outside of the area, you're welcome. You will be using that. It sticks with you, regardless of where you're located. Is a possible solution of placing students in hotels only for students in the on-campus accommodations, or does it apply to undergraduate apartments in Isla Vista also? Thanks.
The hotel situation is only going to be for people who are listed already or waitlisted in the housing waitlist, as it's been going on. This basically is for people who have been trying to get a housing contract and are unable to get a housing contract. So it's not for anybody in Isla Vista, but if you're on the waiting list, you might be considered for that.
Thank you. And it looks like Mark just answered our last one there. If you have any other questions, oh, here's one. Okay, thank you. For the one that looks like it's in Chinese, please translate that for us.
I see the other question, actually. I believe we are all required to get a COVID test within 72 hours before traveling to the United States. Yes, so we know when you enter the United States, there's a requirement that you have a COVID test within 72 hours or 3 days negative in order to go through the customs at entry in a United States airport. However, even we still at UCSB are requiring an additional test when you arrive on campus before you get your keys for housing, because we want a real-time result right there, and we want to do it in our own lab so that we know the accuracy of the result. We can be confident about it. So I've had that question a few times, and I'm sorry, I have to tell you, you will have lots of COVID tests to keep everyone safe, but yes, you have to do it when you arrive at UCSB at no charge. We are providing this.
Yes, and that addresses, I think, the next question, just to make sure, do I need to get a COVID test before I get into the dorms when I'm fully vaccinated in my home country?
Yes, that it's a recent change, so I'm not surprised we got a question about it. Probably because of the Delta variant and the concern that even vaccinated persons can sometimes get the COVID with the new Delta variant, which is completely predominant here in California. Then we just recently changed our strategy to include even vaccinated persons moving into campus housing have to get a test when they come on campus before they get their keys.
Who should I contact if I haven't gotten my writing classes sorted? That would be someone you would contact in your academic department. You'll need to ask them about your classes and any classes that you may still be waiting to get into. So I would recommend contacting your academic department for that.
Here's a fun question. Do we need to get the nose test, which is the Q-tip or the swab put in your nose? Actually, on campus, we're using the saliva test where you spit a small amount of saliva into a little tiny funnel. And so you won't have to worry about getting a swab in your nose when you're at UCSB.
Okay, thank goodness. That means you've had the nose test before, whoever put that in there. All right. Again, if you have any questions, other questions, go ahead and throw those in the chat. And we will stick around here for a few more minutes to answer those. Here's one. How long do we need to wait to get our COVID-19 test before we move in?
Oh, I'm glad someone asked that question because I can clarify. We don't need to get the result of your test before you move in. You just need to get the test done. So as soon as you get the test done, as you spit in the little funnel, then we mark you cleared in the computer, and so that we're not making you wait a day or two for the result. But we are really happy we have our own campus lab here that we've developed over the last year. So we're generally getting results in less than a day, sometimes in just 4 to 6 hours. So we will know pretty quickly and we will email you your result as soon as we get it. So that should reassure everyone. But no, you don't have to wait for the result to be able to move in.
Well, thank you to all of our participants who attended this evening's event, at least this evening in California time. Thank you, Dr. Ferris and Mark, for joining us. Really appreciate your insight and giving us such up-to-date information on, and hopefully just kind of easing some anxieties and unknowns as we move forward into moving back onto campus. So thank you both for joining us. And also to my colleagues, Eric Williams and our director, Simran Singh, thank you for both for participating in this. If you have any questions and have any follow-ups, please let us know. You can email us or contact your OISS advisor. Oh, it looks like we have one more question here. When we move in the dormitories, will the school send us some medical things such as alcohol spray?
Well, we are supplying students with face coverings because that's really important. If I didn't mention it before, right now in California, face coverings are required in all indoor public settings. So even in the dorms, in the hallways and walking around the dorms, we want you to wear your face coverings in campus housing and in classrooms. So we have a lot of free masks for everyone, but no, we're not actually supplying alcohol spray. We have great cleaning protocols in the dormitory. So if you want alcohol spray, better bring it yourself. And here's another question. If I live off campus, do I need a COVID test? If you are fully vaccinated and you live off campus, we do not have any COVID test requirements. You are welcome to come get a campus COVID test if you like. And if you're coming from out of the country, I really suggest you do that within 3 to 5 days of arrival. That's the recommendation from our public health authorities, but it's not something we're going to enforce on you right now.
When will the recording of this webinar be published? We'll hopefully get that up before the end of the week on our website. With all of our CALI trainings, they are accessible on the OISS website. So we will have that up. And we'll generally send that out when we announce the final webinar as well, just as a reminder as to where you can find the information on our website. So we will keep you updated on that and hopefully get up in the next day or two on so that you can review it if you had missed anything. Alrighty. Again, thank you everyone for joining us. It was nice to have everyone here, and we look forward to welcoming you all to campus in a safe and healthy environment. And I'll tell you what, as someone that works with students regularly, I really look forward to being able to see you in person. Campus is not the same without you. So we wish you safe travels in getting here, and we'll see you in a couple of weeks. Take care.
Bye-bye.